What is happening is very typical of a viral pandemic is that, the first time a virus tries to, show its presence, it's obviously, more virulent, causes a lot more disease, and it spreads quite a bit. But as it tries to reach the stage of herd immunity, it reaches to a mutation where it now spreads more actively. So this second wave is a lot more infectious wave, which means that even in very short duration, a very high amount of virus can be transmitted from one person to the other, and that's why between the gap when the first wave was tiding down, a lot of gatherings and a lot of crowding, and people were letting their guards down, is a perfect opportunity for a second wave, where now the virus can easily spread and inoculate itself into a large number of people, and that's why I don't think there's anyone who doesn't know someone who's COVID positive in their family or friend network.
Yeah, yeah. And I want to ask you this, that, many people have asked this question, and I said that we're going to have this conversation. They have WhatsApped me this, is, about around how can we protect ourselves? Like, of course, besides the mask, are there multivitamins, vitamins, sorry, but things that, protect us and make our immunity system better?
Yes, definitely. Vitamin D, consistently, good and normal vitamin D levels have consistently shown a positive correlation with immunity. And those who find out that their vitamin D levels are low, you can take a quick course of, there's a dosage over a few weeks that can bring your vitamin D back to normal. But vitamin D levels are going to be protective. There always have been, and there have been no confusions in that. Vitamin C obviously helps in healing and recovery. And a lot of people with, diagnosed with COVID or similar flus are given vitamin C. And zinc has had a role, zinc and multivitamins, in the form of syrups and capsules. These minerals and multivitamins have been, helpful in faster recovery, faster healing, and also reducing the initial impact.
So you're saying vitamin D, vitamin C, and zinc.
Zinc with minerals and other minerals and
Zinc,
vitamins, yes.
yeah.
Yes.
Okay. Thank you so much. Thank you so much, Dr. Jagdish. You know, the other question which everyone is asking is that this time we are seeing a lot of young people get COVID, and a lot of young people who are also dying. Uh, how do you explain that?
I think the first wave largely, infected older population, and it had something to do with the, ACE receptors, the receptors in the blood vessels that were related to hypertension. So older people with more comorbidities were the ones who were affected. Then when the vaccine got rolled out, I think fairly large population of older population have vaccinated themselves, and also in this whole year have become very aware in their natural, schedules to wear masks and, protect themselves, from their grandchildren and children, to keep the little bit of small social distancing and mask wearing behavior has come in. This, increased, this second strain, which is rampantly spreading, is not looking like it's using the ACE receptors, and that's why people with hypertension and older people with comorbidities don't seem to be getting it. In fact, we are seeing young children as 5 to 7 years of age, who were earlier previously asymptomatic because they didn't have any hypertension or ACE receptor, liability, now are falling ill, and they have mild to moderate symptoms. But some of my pediatrician friends also tell me that they are seeing kids on the ventilator and they are seeing kids with severe
Oh,
pneumonia. Though it's a smaller number, but a larger number of children have 2 or 3 days of fever with runny nose and cold and throat pains.
yeah, this
And
is,
that's the reason why, and from children, their parents. And that is why I think initially the grandparents have constantly been keeping their distance, but parents have not with their children. It's very hard to do that with younger children. And that's why from children to parents, and that's why that age group of 35 to 45 is largely affected.
uh, Dr. Jagdish, two things. One, many people are very hesitant to get vaccination. And we have not seen, though the government has rolled out, we have not seen many people go. In fact, in my own circle, many people are very hesitant to get vaccination. And the second thing I want to ask you is that people who got vaccination are also getting COVID now.
Yes, I am a
What does
living
that
example.
mean?
I have received both doses of Covishield, and with a good 1 month after the second dose, fully immunized. And I am right now sitting beaming with COVID positivity. I was tested positive yesterday. But
But
what
I
a
have to tell you, thank you, thank you, thank you, thank you. We love you. Thank you for doing this for everyone. Thank you for always helping and being there. Yes, tell me.
Appreciate it. So, see, a vaccine generally never is meant to prevent a disease onset. It is always designed to prevent a disease complication or severity. Our entire population is BCG vaccinated. Still, we are a tuberculosis capital. But a large number of these tuberculosis cases are tuberculous lymphadenitis, and they're not the very severe ones with complications, even though that is still in a pretty high number. And even we take flu shots and we still get flu, viruses. Similarly, this vaccine, all it does is it allows certain amount of immunity, immunoglobulins in your body, in your blood to be ready to fight. Now, if the viral load, and this is something very important, one of the reasons why this highly infective virus is causing such a havoc is because of its very high infectability. The viral load is very high compared to what we were probably getting in the wave one. And if the viral load is high, like for someone like me who's fully vaccinated but spending time in the hospital, exposed to very large amounts of viruses, it can still overbear my immune system. But I'm asymptomatic. I hardly am feeling unwell at all. And so far in India and internationally, 100% of cases of people who have been vaccinated have not ended up in the ICU in severe disease. And that is what a vaccine does, is it keeps it mild. It allows you some time to build your immunity because it already has some soldiers made for you. It's just like in your house, Shraddha, if you have 10 security guards and a mob of 100 people come, you will get some time to get another 50, 20 people because those 10 will give you some time, right? But imagine no one there and a mob of 100, 200 people barge into your house. You won't even have a time to react. And that's what happens with our cytokine storm and immune system. And we are completely devastated by a very high viral load. So that is why I strongly recommend that everyone should be vaccinated and keep our expectations realistic. A vaccine is not that, I still have COVID after a vaccine. Why should I get a vaccine done? What you should say is, you are not going to get into the ICU. You're not going to land up with oxygen shortage. You're not going to go into a crisis. You're not going to go into complications because of the vaccine. You've been having colds all your life. You will have one more just like that, and your body will be allowed to fight it with the vaccine and the immunity that it creates.
Mm. You know, again, a question which has come from a lot of family members, parents and grandparents of people I know. What do we do when the oxygen level drops?
Yeah. Now, there are different schools of thoughts. Well, we have to start monitoring oxygen much more earlier, even at the time of exposure. Many times we wait for a positive result and we wait for symptoms before we start putting that pulse oximeter.
Hmm.
If anybody is tested positive in their house and they're even asymptomatic, their family members should routinely check their oxygen saturation levels because of the oxygen dissociation curve of any saturation over 90. You will not see much of these symptoms of breathlessness, and those changes are also very, very gradual. Once it's below 90, it goes really quickly down to 80, 70, 60, 50, and all of that. So picking a downward trend very early is important. To know what your baseline saturation is very important. Some people are chronic smokers. Some people have some underlying lung disease. Their baseline saturation itself may be 94, 95. But it's good to know that even at a normal state, what your baseline oxygen saturation is, so that when you start monitoring regularly, you are seeing a downward trend. Then you should start doing some things to improve your saturation. That is, sleeping in prone position, doing certain breathing exercises, improving your vitamins, wearing masks, preventing the viral load. That will significantly reduce your chances of getting into a bad lung disease.
Sorry, Dr. Jagdish, you might hear my dogs, but
No problem.
again, asking about this, what you spoke about,
Yeah.
viral overload.
Yes.
What is viral overload, first of all, and why are some people asymptomatic and some people have to go on ventilator?
Yeah, so the virus chooses basically its host based on its most likelihood of multiplication. If it finds a good host where it thinks it can easily invade the cells and multiply and replicate, it will start doing that. But if it finds this host has a good immunity and it's probably going to struggle, it just remains dormant. And it might just look at it as a carrier and move from one person to the other. Viruses are very difficult to understand, but they're also known to be very smart. They change their phases. Many times they're inactive for many years and they just activate themselves 10, 15 years down the road. Not for COVID, but other viruses that cause cancer and those kind of things are known to, be dormant for many years, and they reactivate when they find the opportunity. A viral load is basically every time we speak or shout or we talk or we sneeze, these viruses come out in form of micro droplets, which we cannot see in our naked eye, but they can throw up to 6 feet or 8 feet in distance. A high viral load means even a small microdroplet has a very dense amount of viruses that are they're very fast multiplying and infectious. And in the second wave, we are seeing that kind of a very high viral load. And there is also some data that was put out by Lancet that is saying that these microdroplets are now airborne. Earlier, we never thought it was. We thought they were bigger droplets that would settle down, and we were doing a lot of surface disinfection and hand washing. Surprisingly, you don't hear much about that nowadays. You hear mask up and social distancing, but the hand wash is not being pushed so much because it's very negligible amount of transmission that's happening through contact. Micro droplets in the air are becoming the bigger reason, which means indoor spread is higher, especially if you're in a workspace, especially you're in a metro, or if you're in a hotel or in a place where the same air is circulating. Your chance of having a very high viral load from a large number of people is high. Hospitals, schools, these kind of places. And that's why the second wave has infected a large number of people who have this history of either attending a wedding or an event, or have been working, or have been in closed indoor spaces with more number of people. They are the ones who are actually ending up with bad disease. Not so much the ones who have been working from home and have just been exposed to 2 or 3 people. That's a pattern that we're seeing quite clearly, with this particular second wave. So that's about how the viral load becomes high. It's because of large number of people exposure.
Dr. Jagdish, I want to ask you, yesterday there was this, I don't know if you saw in One India and a lot of places, money control everywhere. There was this article that if you are a smoker and if you are a vegetarian, then, you are less susceptible to getting COVID. And then I thought that it was, I don't know, it just didn't make sense, because there was earlier last year, there was this thing that came from Europe, and then they refuted that, oh, it was, promoted by tobacco companies. But I want to ask you, because everyone has been circulating this in WhatsApp group, that if you're a smoker and you're a vegetarian, then you are less susceptible to COVID. Is it true?
No, I don't. I can't really draw any direct correlation, Shraddha. But sometimes what happens is when you are looking at only one parameter, right? Like smoking has so many other problems, especially towards your barrier of immunity that it creates for any flu or virus. But if they're just looking specifically at COVID and they found certain parameters that it weakens the virus or something like that, that in a realistic setting, maybe in an experimental setting that might work, but in a realistic setting when smoking plays multifactorially a risk for you to develop any lung infection. Even if let's assume that it reduces the infection of COVID, you still get other infections that will reduce your immunity and then allow COVID to grow back, or impact you higher. So I won't really take too much of these kind of information and act upon it. I would know about it and follow up. If you look at the trends, everything that initially showed a sign of benefit eventually in larger studies started showing the opposite direction. You can see that with hydroxychloroquine, you can see that with remdesivir, ivermectin, Fabiflu, you name it. Initially, they look like they're creating benefit, and over a larger data, they don't. Even now, with a large meta-analysis, they still say O positive is protective even after a large study. O positive blood groups are less susceptible. A blood groups are more susceptible, and these are correlations that scientists are trying to find and see if there are ways. But they're good to know. I won't act upon it. I won't definitely start smoking or smoke more because of that.
Thank you so much. Thank you for clarifying. I think people should uh, uh, quit smoking, right? Like
Yes.
yeah, like all of us, this is the time to quit smoking. Dr. Jagdish, the other question I have to ask you is, around, we are all seeing on social media, and it's very scary, depressing, and very heart wrenching that oxygen nahi mil raha hai, cylinders nahi mil rahe hain, beds nahi mil rahe, it's not available, and it's tough. Now, what do you suggest people who get COVID or who test positive? You need to, what do we need to take care of, and what are some of the medicines which we need to have?
Yeah. So first thing I'd like to say, Shraddha, is a very important question. Those who test positive should know that your chance of getting into that oxygen crisis is already very, very little. Okay. I know we panic, we always prepare for the worst. And one of the reasons for this crisis that we're facing is a little overprotective decisions that we are taking. But remember that for saturation to go below 90, if you identify your illness early, you mask up, you reduce your viral load, you start doing prone breathing. Prone position means sleeping on your belly, and you start taking care of yourself. Your likelihood of going down that route is going to be very less. But we don't know that, and that's the reason people have that panic, that what if, and that what if, what it is doing today is getting a lot of people who don't really require a lot of oxygen are occupying the beds. As it is, we have very less number of ICU beds in our entire country. And on top of that, oxygen is usually only limited to certain wards, certain critical care units. It is not really a line that's available for all beds in most hospitals, even though the larger hospitals do have that facility. But we are seeing, and this is something that I've heard from my friends who are at hospitals, is that there are bulk bookings from families, influential families, and people who are just blocking their beds and being there because they think they may deteriorate, but they eventually don't. And they are usually around that 95, 94, 93, but not having any
Yeah,
symptoms, but still taking oxygen, using the resources, preventing the beds for people who require it a lot more, urgently. People
yeah.
with 70s and 80s, and that number is not very high. But unfortunately, those people are not surviving because of this overreaction that we are doing, which is also a survival instinct. But we have to be a little more trustworthy of our capability, of our immunity and our disease, and not take those decisions. But what you can do at home is you can rent an oxygen concentrator if that is available. Also, it is not right to just hoard it if you don't feel the need for it because somebody
For
else.
where, Dr. Jagdish, do you have recommendations from where people can get oxygen concentrator at home?
Yes, some of my patients have rented out oxygen concentrators from Portia. And also, if you go, there are a lot of manufacturers and distributors of oxygen concentrator. If you use that word, there are 5 liter and 10 liter capacity oxygen concentrators, that are available. And most of the people don't require more than this amount of oxygen. And to explain what an oxygen concentrator is, it's a machine that takes oxygen from your air, concentrates it, and gives it to you at a higher percentage over a particular flow that you need, 2 liters per minute, 5 liters, 10 liters per minute, so that you get a little more high flow oxygen into your airway to build up that saturation.
Dr. Jagdish, sorry, just a very, maybe sorry, dumb question, but we are seeing so many people die because of lack of oxygen
Yeah.
concentrate and oxygen that they're getting. Why? Why is that happening?
So there are the oxygen cylinders are again in shortage because everyone's taking them, and oxygen cylinders have a life. They will run out of it, and you have to refill it, and then the refilling has to happen from a plant, and we don't have that many PSA plants of oxygens, which were there is a lot in the news that says that so many plants were you know they were budgeted to put out and they were not really made. So overall, the source of oxygen for those filling of those oxygen cylinders, there is a scarcity and havoc there. And there are very few companies that manufacture oxygen concentrators, Shraddha, and they're expensive. They're 60 to 80
Yeah.
to a lakh rupee plus. These oxygen concentrators is very big. It's like a washing machine size, device. So it's not like it is very easily available and everyone can afford it. And those who rent it are also usually overbooked and are there.
But Dr. Jagdish, my question is also around this, that why is it that some people are needing this and some people, and then many people, like, are
Yeah.
asymptomatic? Again, it does it boil down to the immunity?
Yeah, it boils down to the high viral load and kind of a bit of a delay in identifying it. So some people, they take some medications that they probably see on WhatsApp or their friends, and there are certain combination of drugs. If you think you have COVID, start taking them, and many times some early signs of pneumonia may be missed out, and some specific medications to revert the pneumonia may not have been started, and then they start seeing that, oh, my saturation right from the beginning is 88 or 85, and they panic. And when they panic again, then they are not sure if the device is wrong or incorrect, and then they try to get another device and they lose time, and then everyone basically just panics, and then they run helter skelter, and I think that is one of the reason. I think we will see a decline of this because now people are a little more vigilant, and you can pick your illness early. If you're in contact with someone, you should constantly monitor your oxygen saturation, because happy hypoxia is a state where you won't know when your oxygen saturation is dipping, but you're feeling absolutely normal. And when you find out, you have only few hours left. And those are the kind of people that are getting into this very acute scarcity of oxygen.
So this is irrespective of your immunity, you are saying.
This is related to your viral load, is what I would say. People
Okay.
who have had very high exposures of viral loads, have been in a crowded place, or have attended events, or have been working in a place where there are many people, and they have a very high viral load, then the multiplication is so fast that it can progress to pneumonia and desaturation very quickly. Uh,
Okay.
yeah, but versus those who are at home or are keeping their social distancing, wearing masks, their chance of having a high viral load is less. Even though while wearing masks, you can still get COVID and you can still have it, but you'll have a very small, much more comparatively smaller load that is manageable by your immune system.
Dr. Jagdish, I'm taking some questions which are coming from the viewers. One of them is, I'm down with COVID, anonymous attendee. Good evening, Shradha and Dr. Jagdish. We love you. Take care. Lots of love. Uh, how long does it generally take to recover from COVID? Also, is loose motion a symptom?
Yes. The second wave is showing a lot of gastrointestinal symptoms, and that is what I would say a sign of a slightly weaker virus, which is now largely so much in your nasal secretions that when you swallow them, they can cause gastritis, they can cause vomiting, nausea, loose motions, intestinal problems, and also in some cases we're seeing piles as well. So it is definitely quite a common symptom in the second wave. And to answer your first question, the second wave is taking an average 10 to 14 days for full recovery, versus the first wave where we were seeing people recover within 3 to 5 days when they had mild to moderate symptoms. Now we are seeing a pattern that people are having this fluctuating 99 degrees to 101-degree Fahrenheit fever going on for 10 days, 12 days, 14 days, despite their taking of the medications. And then they have this interim period, they're feeling better, and then the fever comes back, and now they're not sure whether it's a new infection or the same, but we're seeing that pattern a lot. We're also seeing saturations being between 93 and 95, which is just at that border where you don't know whether should you take the decision to go to the hospital or be at home. So, but from what we are seeing now with large number of cases is that if you wait these periods out, you will get back to normal a majority of the times.
Thanks, Dr. Jagdish. Thank you. The other question which a lot of people are asking, and here Divya has asked, is how do I get over the weakness that comes post getting COVID?
Yeah, the weakness and myalgia can be quite significant, and the best way is to take rest. Drink plenty of fluids, about 2 to 3 liters of fluids with electrolytes, possibly like ORS. Rehydrate yourself well. Take your vitamins. These vitamins like vitamin C, zinc, and B complex or zinc-ovit like combinations of multivitamins and minerals. And all of this will help you, get over it. Don't exert yourself during this time. You're weak because your body is fighting the infection. It needs to divert all its energy towards that. So take some good rest at that point of time, and do not panic or put yourself or your family at stress during that time. But also expect that this weakness may last for a week to 10 days. Having a lot
Okay.
of fruits is good. Fruits, and if you're not diabetic, a bit of sugar can help you, feel better quicker. And if you can do some exercises while you're on the bed, especially breathing exercises while being on your belly, maybe some pranayam or yoga if you like, or just some deep breathing and meditation can help you as well.
Dr. Jagdish, one, I don't know if it's a myth or a fact, but you have to tell us, is that a lot of people are saying that, the actor Vivek passed away, and then there's this huge speculation that it was because he took the COVID vaccination. What do you have to, and then a lot of people I know are fearful that if they take the vaccination, then it's very, their life is in danger. What will you say to that?
So your question is it safe to take the vaccine? Is that or what?
Yes, absolutely, absolutely, yes.
It is safe to take the vaccine. See, there are some complications that have been seen with Covishield, but if you see, about 11 crore people have been given Covishield, and if you look at the recent data that came out, I think released from ICMR, there's a very tiny population that develop reinfections, and there have been cases of increased blood clotting that have been seen, but that can be picked up with certain investigations like D-dimer and all of that. But that is happening to a very small amount of people, and that happens with every vaccine or drug that you develop. That there will be always a small population that develops an adverse effect to it. Even if you take peanuts, there are a lot of people. In fact, a much larger number of people are allergic to peanuts and can develop complications to something which is just ineatable. So this is an engineered, medical component that helps you build your immunity. But the vast majority, large number of people do not have any permanent complications. And if you weigh the benefits over the risk, you have to lean towards the benefits for the vaccine, because the risk of developing COVID, as you can see, is far, far, far more damaging than those very, very, very small numbers of blood clots and those kind of incidents that you're seeing. Versus not having oxygen, being stranded with permanent pneumonia and fibrosis and lung problems, and those complications are far more higher with a COVID infection than small complications with a vaccine. And majority of the people who are taking the vaccine, they develop 2 to 3 days of common symptoms. You have pain and soreness in your arm. You can develop some fever and weakness, just like you are with a mild COVID infection, and you will recover from it.
Thank you. Thanks. This is such a helpful session, and thank you so much for doing it. And you tell me when I tire you, because there's so many questions. So
No problem.
one is, no,
I'm in
no, no,
quarantine.
but
I have all the
you,
time.
no, but you have been so helpful throughout the last 1 year. Thank you, Dr. Jagdish. I have to call it out, like doctors like you make it, make us believe in our system. Now tell me something, that one of the questions is that we're not getting hospital beds, we're not getting oxygen cylinders, and we are in an acute situation. What are some of the things that we can do if we are not getting beds?
Well, I know that it's a very helpless situation, and I don't have a very easy answer for it. One of the things that you can do is obviously try and arrange for some oxygen concentrator or oxygen cylinder yourself through your connections. I know that is not easy even today, but if that can be done, that will get you some time. The prone position breathing has been showing a lot of positive effects. Lying down on your belly and breathing reduces the load on the lung and helps in clearance of the alveoli, the secretions from the alveoli, and helps improving your oxygen saturation. Those are some of the things that you can do. And if you and obviously getting treatment from qualified medical professional under moderate and severe lung conditions to provide you with steroid medications can be life-saving. Do not self-medicate yourself with any kind of steroid medications. It is not indicated in early stage disease or preventive disease. In fact, it'll do you more harm, because steroids reduce your immune response and you can develop more infections. But when you are having this problem with oxygenation and you are moderate to severe condition and you don't have any of these things, a qualified medical professional can give you the right doses of steroids and can reduce the inflammatory process and improve your breathing. So please stay in touch with a qualified doctor who knows how to treat severe lung conditions. And these are the things that you can do. Though a lot of people run around for remdesivir, ivermectin, plasma, and Fabiflu, and all of these things. To be very honest, if we follow the data and the literature, there haven't been any conclusive studies that show that these are beneficial. But still, people are doing that because they think it's a last resort. But I think if the focus is on improving the breathing, better posture, getting oxygen, and using the right dosage of steroids have 100% worked from its mechanism and has helped in severe lung diseases. I think that is where we should focus our energies on.
Uh, Dr. Jagdish, one question that has come in just now is that, people who got COVID last year, they lost their sense of smell and taste, and still that has not come back fully. And do you suggest something? Do you think it's okay, or do you have anything that they should be doing?
Yeah, so fortunately, our olfactory bulbs are the only one of the set of nerves that can regenerate fully. So, in an ideal case scenario, you should recover your smell completely and taste also completely. These are temporary findings. I think we have not, like I personally have not heard people having no return of smell for a year. But if that is, that's unfortunate, and that probably means that you've had either chronic allergies, chronic nasal allergies or nasal stuffiness or chronic inflammatory process in the nose throughout the year, because COVID is not the only cause for loss of smell. Chronic nasal allergies and nasal infections are also a cause of that, and that needs to be evaluated if there is something else. On an average, 2 weeks to 4 weeks is where we see most people recover with their smell and taste. Some people recover even within 3 to 5 days. What can you do? You have to take your vitamin C's. That's the one that helps you with healing. You should take your B complex, especially B12, which helps in nerve healing. So these B complex, zinc, vitamin C, and drinking plenty of fluids and hydration is the thing that's going to allow these nerves to clear out. You can also use saline nose wash and nose sprays that can wash away any allergens or any secretions or any mucus from the nasal roof, from the olfactory area. That can probably help in smoother or faster, recovery. And again, be under consultation with the doctor. In some cases, the use of nasal steroid sprays can also help you recover this, but not for everyone. There are certain selective conditions where nasal steroid sprays may be used to help get your, smell back.
One question is that has just come in. People who got affected with first variant, can they get reinfected again? Is it a rarity or is it a norm?
No, they absolutely can, theoretically. And again, just like someone who's vaccinated can get the infection again, depends upon the viral load. Now, your immunoglobulins or antibodies after an infection stay for 6 months on an average in the bloodstream. But when you get reinfected, it's not like your body is going to build your immunoglobulins from the start. It already has a memory system, and it will build it much quickly. But when you get an infection for the first time, you first build large antibodies like IgM over 2 weeks, and then you build the more mature antibodies called IgG. And once you have these IgGs, they float in the bloodstream for about 3 to 6 months, sometimes more, and they will protect you from a second, infection if the viral load is manageable. But if you have a very high viral load exposure, and you land up in the Kumbh or some place where there is a lot of rush or wherever it is, where there are too many people there, it is not a given that your immune system will take any viral load, right? It also has a limitation. And if you get exposed to a very high viral load, you will definitely develop symptoms, though they may be milder, and your body will be able to generate more antibodies much quicker and fight it better. So the chance of complications will be lesser, definitely, but you can still get reinfected. And you very much can spread it to others.
I don't know if it's how seriously to take this, but important question. Some people are saying that post-vaccine not to have alcohol for some days. Is this true? As I was talking, many of people who are 45 plus and did not take vaccine because of this.
Yeah, so the Sputnik V, virus that was developed in Russia had this very strong protocol that for 40 days after the vaccination, you cannot take alcohol because there was a component that, could react with it. But the adenovirus that we have developed here with Covishield and Covaxin do not really have a very direct association or conflict with consumption of alcohol, though alcohol reduces your immune response. One of the reasons why most people catch a cold or fall ill after a drinking bout of episode is because of the alcohol and the ice and some of the food that you're taking with it. It definitely reduces your immune abilities around your your digestive tract and your oral cavity. It if you develop a post vaccine complication or an infection, maybe after consumption of an alcohol, you may have slower healing or recovery. So for those reasons, yeah, it is good practice not to consume alcohol, but it is not a very direct contraindication, with the vaccines that we have in India. But definitely with Sputnik V, that is something that they've said very clearly.
So Tina Sharma is asking, and again, I'm just saying, is that that getting what you said, Dr. Jagdish, is that getting vaccination, uh, you can get the COVID again, but the severity of it will be less.
Yes, and so to reiterate the answer, if you have had a vaccine shot, it only gives you certain immunity or immunoglobulins. They're dead viruses, or like in the Covishield, it is an adenovirus that replicates and creates a dummy spike protein, so that your body thinks it's a spike protein of the corona, but it's not the actual virus. It's just the spike protein, so it produces the antibodies for it. Now, everyone will develop a different level of antibodies. Some will develop less, some will develop more based on your immunogenic. Now, when you get exposed to the coronavirus, if your viral load is less, then this you will not even know when your antibodies will take over it. But if you are exposed to a large volume of virus, then your antibodies, by the time they generate new antibodies and they fight this, you will develop some symptoms. You may test positive, but you will not go into a severe complication or develop pneumonia. That is what the vaccines promise to give you. So again, set your expectations that getting a vaccine is going to prevent us to have a bad complication. Don't set yourself as, if I get a vaccine, I am never going to get COVID or corona in my life. That is not true for any vaccine.
Yeah. Dr. Jagdish, another question. Is it safe for people with extremely low platelets due to bleeding disorders, ITP, to take the vaccine?
Yeah, I would defer that to their treating physician. See, one of the complications of the vaccine is causing clotting, and if you have low platelets, there is actually a lesser chance for that clotting to happen. But you can, because there is an injection that's going to be put in over here, and the healing of that area may cause some bleeding or hematoma locally and an infection. So we have to take a judgment call based on that, and maybe the treating physician can decide whether you want to replace platelets, get yourself to a particular level before taking the vaccine, or you can still take the vaccine. It's not a very black and white answer, because we are all learning and learning from the vaccine and its effects on a daily basis. But if you have ever been infected by COVID, you can safely defer taking the vaccine for 3 to 6 months, because you already have immunoglobulins. You can wait for a better time when your platelets are better to take it. But if you've not been infected at all, and if you just wear mask and social distancing, that itself, like when people say mask is like a vaccine, it is actually true. It's a physical barrier that reduces the viral load. Again, I'm saying reduce. Don't go into that argument that one will enter from here, one will enter from there. It's not about one or two entering. It's about the viral load, and a physical barrier definitely reduces a viral load significantly, which even your normal immune system may be able to handle, like it handles so many colds and flus that you've been suffering from all your life. So if you don't want to take the vaccine because of certain complications, you have to just ensure that you wear a mask in crowded places, in indoor places now where there are a lot of people. And most importantly, I've not touched upon this, but there's a very direct benefit of ventilation in closed spaces. If you open your windows, you heal faster. If you open your windows, your chances of getting the virus is going to be much lesser. Just like when you go outdoors and you keep social distancing, it's less likely that the virus will linger in the same place. But in indoors, because there's not so much circulation and cross ventilation, they stay in the air for longer periods of time, causing things like the second wave. So if you open the windows and there's good cross ventilation, it significantly reduces the chance of you developing a viral load. So you can do those things and not take a vaccine by weighing the clinical benefits.
Thank you so much. After how many days can you say that you've recovered from COVID?
Typically, you are non-infective in 10 days from your first day of the symptoms. That is what we believe theoretically, and that's why our quarantine protocols have come down from 14 days to 10 days when we test at the seventh day. So typically, one is considered non-infective after 10 days of the symptom, but we keep 2 weeks as an overall healing process. But there are data that says that you can have the dead virus floating around and certain amount of the virus floating around for up to 90 days and you can still be infected, but that's a very, very tiny and minute number.
Dr. Jagdish, if you are diagnosed with COVID, then do you start, what is the line of medication that you should start, including azithron, an antibiotic?
Yeah. So if you tested COVID, and again, another topic we didn't talk about is the CT value, which is a cycle threshold value. If your cycle threshold value is less than 24, you're considered to be extremely, infective to others. If your cycle threshold value is over 24, your chances of spreading to others is lesser. So if you are COVID positive and your cycle threshold value is over 24, self-isolation, wearing masks indoors, and taking just multivitamins like vitamin C, zinc, minerals, B complex, vitamin D, plenty of fluids is good enough. There is evidence to say that when you start with a course of azithromycin, 500 milligrams once in the day for 3 to 5 days, in the early stages, it does reduce the viral load. And since it's a very commonly available antibiotic and not one of those antibiotics that are considered to be very strong and damaging, it's a common practice that many people take a short course of azithromycin in their early days. If your CT value is less than 24, that may not be a bad idea for you to take a short course of antibiotics. Some other schools of thoughts is giving doxycycline and all of those things, but there's not as much data supporting doxycycline as much as there is for azithromycin. Because there are a lot of GI symptoms, a good antacid and some sort of lactobacillus, like Visilac or Yakult and those kind of things that improve your gastric flora can be of benefit. And things that some people are getting constipation, so they can take some, diet that, that can soften their stool softeners. And otherwise, those who have loose motions, they can take high fiber diet to improve their, motions. I think that is about it. Other things such as Fabiflu, ivermectin, remdesivir and all, and steroids are not indicated in this early stage at all.
Okay, thank you. A lot of questions are coming, Dr. Jagdish, and I've just been looking at my WhatsApp, like you are talking and the questions are coming. So, of course, we can go. No. I'm feeling very guilty now that you've tested positive and we're just speaking. You talk, and always we have done that through the last 1 year. Now, just one or two questions I'm going to take on mental health. Right? Because a lot of people are very depressed. A lot of people are very, very anxious. And now the kids are also involved. What would you say?
With kids, I mean, there's a positive way to look at it. I mean, I have 2 kids myself, and we have gone through this anxiety and we are worried for them. The thing is, with very little kids, like my daughter's 1 year old, we can't really make her wear a mask or a shield all the time. And, a lot of other kids come and they, play with little babies. So we are always concerned, but even in the second wave, we are not seeing anything severe happening to them. Though we still have to wait with all the kids who have been infected to see if there are any long-term implications. But as of now, it doesn't look like it was anything other than a few days of fever and cold. And if you look at it in one way, it's a way to get them vaccinated. I mean, they have now some immunity and some immunoglobulins after an actual infection, because studies for vaccination in kids have been paused, and we don't know how long it will take before kids start receiving vaccines. So having, if they pass off as a mild infection, it could be something that you don't have to be so worried about, and probably it will protect them for the next 3 to 6 months from other similar infections as well. Uh, but otherwise, there is anxiety, and there is anxiety largely related to dropping oxygen and oxygen requirements. And that's why planning early and preparing early can alleviate a lot of that. And what you can do is the moment you are in contact with someone COVID positive, please isolate yourself. And that is so that you reduce your viral load, because now there are so many people who can be carriers, so many people who are positive, that if you do not isolate yourself even after you've received been in contact with someone, you can have a higher viral load. Having a smaller viral load from a couple of contacts, your body should be able to manage it, and it's not something that will end your take you to the ICU or with dropping oxygen saturation. But if you do that early, monitor your saturation, look for a downward trend, do prone position breathing, take your vitamins, hydrate yourself well, and stay calm. I think majority, more than 95% of the times, there is nothing adverse that's going to happen, and it's just going to pass off as a slightly prolonged episode of corona in this second wave. And I think we need to take a leap of faith and just go with that. Panicking and exposing yourself to the hospital at a very early stage when you don't need it, you may just expose yourself to a lot of viral load that could have been completely avoided, and also expose yourself to medications that you may not need.
Thank you. Thank you. This is a very, very important point. Dr. Jagdish, women with periods should not take vaccine. Is it true?
Absolutely not. It's got nothing to do. Periods is a very normal body function, and there are people who, I mean, there are things that you think that it reduces your immunity, and if you take a vaccine during that time, it will not be immunogenic. But the process of immunity generation is very different, and there is no correlation between or no reason to not take a vaccine during periods. And I would recommend you to neglect any such things that have been forwarded on WhatsApp or told by people who are not from scientific backgrounds.
Shiva has this question from YouTube. My grandfather, 77, with brain injury and diabetes, has COVID. We are giving medicine. He can't be in prone position. Please help.
Yeah, so if you cannot be in prone position, if you can be on your side in some way through support, and if somebody is in on bed rest and bed care with a nurse, or in an ICU or in a hospital, then with support, making them lie down on their sides can be of benefit. Otherwise, if they cannot move at all, and they cannot be in prone position, then that's fine. I think the treating doctor can then look at other ways to reduce the load of fluid in the lungs, maybe through steroids and Lasix and other things.
Thank you. There's this question, when do you have to go for CRP and HRCT tests? Right after you test positive, or should there be respiratory symptoms?
Yeah, so again, the indication for getting an HRCT or a CT scan is limited, and there is a scoring system also that now many radiologists give. You have 6 out of 25, 7 out of 25. It doesn't really change your treatment. Anyone who's COVID positive is bound to have some mild, lung changes, and they are largely reversible. I think HRCT is only reserved for those with moderate to severe illness, and especially when you are looking at their improvement to medications in the hospital. Definitely not indicated with anyone who's taking home care and is quarantining themselves at home, and all of that. CRP levels are only going to tell you the infective status. It really doesn't change anything that you do in terms of your medications and all of that. These are monitoring parameters that we look at, especially when patients are admitted, to see if the medications we are providing to them are creating any positive improvement or not. So I would not recommend anyone to go for these tests at the moment with your early stages at home.
Haim Kusum is asking, in a neighboring village here in Shanti Niketan, West Bengal, and an old lady was dissuaded from taking vaccine because she is diabetic. Was it a good decision?
Not at all. In fact, people with diabetes and old age are more vulnerable to infections like COVID, and a vaccine can easily protect them from it. So I would really recommend anyone with diabetes, hypertension, and in the vulnerable age group to actually take a vaccine. The vaccine is designed for for these people only. I mean, it is vaccine is to be given to the vulnerable population to give them a layer of protection. You can't protect them from the vaccine. That's so ironic, right? You're protecting a vulnerable population from a very small chance of developing some side effect of the vaccine, but you're exposing them to a virus that is lingering free and can be so rampant and dangerous. So I definitely don't think it was a good decision. Please, if you're elderly, you have diabetes and hypertension, please go for the and get the vaccine taken.
Are we going to see, this is wave two, and this is so potent, and this is so debilitating and so heart wrenching? Are we going to see wave three? Are we going to see more of this?
Yeah, so there is a third wave always anticipated in every pandemic. Even with the Spanish flu, we could see the same pattern. The second wave was much bigger and claimed much larger number of lives. And typically, the third wave is much milder because the virus does not find a new host. It has infected almost everyone, or most of the other people are vaccinated in that time frame. So it does not get a new host to grow and multiply. It only faces people with more immunity, and that's where the herd immunity develops. So there is no reason to drop our guards. It doesn't mean that the third wave, whenever it comes, is not going to claim lives, or there can be another mutation that we can completely be unaware of. So I think we have to just accept that with what has happened in the world now with this pandemic, that social distancing and wearing a mask, especially now, even in closed spaces. I'm not saying wear a mask alone in your house. Whenever you're in your working spaces or in closed spaces where there are many people around, I think wearing a mask and social distancing is going to be the norm, even after you get vaccinated, even after you've gotten the infection. And this is not only going to protect you from COVID, but it can protect you from various other things that may be just beginning to happen that we will not be able to predict, just like we couldn't predict COVID-19. And I think we just have to accept that and do that, because that's the only way we are going to be able to survive. Because every time we let our guards down, one side we're affected by the virus, but the other side our economy is hit so bad because the government is forced to do lockdowns. Our jobs are at stake. Our earnings are at livelihoods are at stake, and that itself is such a big issue. So even if you don't believe whether the virus exists or doesn't exist, or even if you don't believe in most of the things that people are advocating, please wear a mask and social distance so that you can work and your economy can grow and you can get a chance to continue doing what you do as a livelihood. At least do it for that reason, and do not propagate not wearing masks and all of that, because then we are all in this situation and we all suffer from both ends, clinically as well as financially.
Dr. Jagdish, we can keep on having this conversation. God bless you. We can't give you anything in this, and we can't. But thank you. We can all give our blessings, and everyone who will watch this, will broadcast. Thank you so much for taking this time out to do this, and especially now that you have COVID. Last, before you leave, and then we'll get you again, is that last before we let you leave, what is it that you'd like to tell people? Because everyone is very nervous. I am anxious. I'm nervous. Night, I don't know. These days, I start feeling, oh, am I getting breathlessness? There's a lot of anxiety. What will you tell people?
I think the anxiety is because of the unknowns. And when you don't know what you don't know, you get scared. But honestly, I am not scared at all. I have the same virus. I am exposed a lot in my clinical profession, but I am not afraid or scared at all, because we've seen lots of other diseases and conditions. And I think for some reason COVID has just been so geopolitically hyped that it has created that fear. Like we are at 195,000 deaths till today with both waves together, and that's the number of deaths people have from burns every year in India. There are 5 lakh children who die every year in India from pneumonia, and there has never been a lockdown or anything like that, right? I'm not trying to trivialize it, but I'm just saying that what we are dealing with is not as scary or as terrifying as many may perceive it to be, especially with COVID-19. The number of people that develop these complications are partly because of a bit of their neglect in terms of when they sought care, or when they let their guard down in terms of overexposure and got too much of viral load, or some of the things that you didn't do early on. But majority of the people, even despite that, are going to survive and make it through. So my only advice, Shraddha, to everyone is that pick it early. Don't leave it for if jab ki tab kind of mindset. If it happens, we'll take care of it, because you don't know where you are in that statistical pool. If somebody is very vigilantly telling you that I have tested positive and you came in contact with me 1 week ago, please be a little more vigilant and check your oxygen saturation. Get yourself tested so that you're not spreading it to other people. Mask up, isolate, all of that. That does not make you a coward. That does not make you weaker. That does not make you the person who's freaking everyone out. That just makes sure that you and your family members do not end up in a crisis like so many of us are facing today. And that is important. And not only the clinical crisis like I'm talking about the financial and the economic
Yeah.
crisis as well. So just like you work hard for your health and your profession, just try to include this vigilance as a part of that. And it's not too difficult, to check your saturations, mask up, isolate, avoid crowding. When you think you are at high risk, you reduce the viral load, allow your body to fight it. There is no theoretical way that you're going to have a bad illness. It's only when you neglect it and you leave it to the end and you realize, oh, now I have such low saturation, now what do I do, and you're panicking. That really is what puts you in a time where you could not prepare for the worst.
Yeah. Thank you, Dr. Jagdish. Thank you from all of us. Thank you so much, and all energies your way. I don't know, you are the medical profession, but I don't know if the spiritual and the metaphysical works. But thank you. There's a lot of gratitude and gratefulness from so many of us watching this and who will be watching this. Thank you.
There
Thank
is
you.
gratitude from my side also, Shraddha, for all the great work you are doing at YourStory. And you've made my day of quarantine extremely useful by being able to reach out to so many people where I was not able to. I was feeling helpless. I'm not in the hospital and now I'm just sitting inside. But you made my time useful. And if I could not answer everyone's questions, my WhatsApp number and email is right up here on your screen. I have all the time in the world. So please feel free. And if not today, one of these days, I will be able to get to your question and respond to you. But thank you once again, and I wish everyone best of health, and hope we tide out of this quickly.
You make us believe in our doctors so much more. Thank you. I can't say more. Thank you. Thank you.